everyone, welcome back to my channel. Let us discuss upper GI bleeding in under 5 minutes. Let us discuss the causes of the upper GI bleeding. There are two main causes, non-variceal and variceal causes. Variceal term means the venous bleeding, and the non-variceal causes or the non-variceal bleeding is the arterial bleeding. So the causes include duodenal ulcer, gastric ulcer, esophageal erosions, gastric varices, esophageal varices, and Mallory-Weiss tear. It is a tear in the gastroesophageal junction. The other causes of upper GI bleeding include portal hypertensive gastropathy. This can lead to the formation of varices, which is enlarged veins, which can rupture anytime. This could be due to chronic alcoholism. And the next is abnormal blood vessels. So any abnormality in the blood vessels could lead to tiny tears in the blood vessels. So this can also be one of the reasons for variceal bleeding in the upper GI. And a large hiatal hernia could also be one of the causes, and any kind of cancerous growth in the upper digestive tract could lead to upper GI bleeding. Moving on to the treatment goals. If the patient has lost consciousness, the ABCs have to be established: airway, breathing, and circulation. This is done to avoid any hypoxia-related organ damage, so if necessary, oxygen perfusion should be provided. Early lesions are treated using endoscopic treatment, which can include thermal coagulation or mechanical techniques like banding, hemoclip, staples, or sutures. Underlying lesions can be treated using PPIs and Octreotide. And the final step is to prevent any recurrences. Moving on to the pharmacologic treatment of the underlying lesions. So the treatment is done using proton pump inhibitors and Octreotide. The proton pump inhibitor of choice here is Pantoprazole, which is given as a 80 milligram bolus, and this is given for over 2 hours, and then 8 mg per hour continuous infusion infused over 15 minutes for up to 3 days. Octreotide is a long-acting somatostatin analog, and it reduces portal pressure and bleeding and is given IV for up to 5 days following esophageal banding. During the treatment of upper GI bleeding in a hospital, prophylaxis treatment is given for hospital-acquired infections. So this could include ceftriaxone 1 gram or norfloxacin, which is 400 milligram twice daily for up to 7 days. So the pharmacologic treatment will include prophylaxis for infection, PPIs, and Octreotide. To prevent any recurrences, there should be cessation of smoking, alcohol, and any NSAID treatment should be stopped. The first-line treatment for prevention includes non-selective beta blockers like propranolol, nadolol, and also carvedilol. So that was a quick recap of upper GI bleeding. Please like, share, and subscribe.